Right now, unfortunately, with the stressful lives that all of us lead, there is a greater and greater number percent of the population that we are seeing that have stress in their lives. And one of the byproducts of that for a lot of patients is grinding at night. Usually you'd have to ask their spouse whether or not, and most patients aren't even aware that they're doing it, but when they come in for their regular checkups, we're able to see worn areas on a lot of their teeth. And the easiest thing that we look for is basically if you look at a river or a creek and you see a stone that's been washed over so many times that the detailed anatomy of a tooth is no longer there, it's just been worn down. Or patients wake up in the morning, their jaw's really sore, they have tenderness up near their ear area, and they don't know what's causing it. So we have the patient come in, we take a series of x-rays, we do a series of examinations, and we determine what the cause of that is. In most cases, the easiest and least invasive thing that we can do is help fabricate what's called a night guard for the patient. If we're able to help open their bite just a little bit and protect their teeth, most patients see almost instantaneous relief within the first month or so. Now, in some cases we may involve additional specialists that may be needed if it's more complex or we don't see any sort of resolution to those symptoms, but for most patients that we have, protecting those teeth, again, as we talked about the night guard or the mouth guards earlier, a small investment to protect having to replace a fractured or broken tooth or then needing an implant.